How to administer naloxone.
Hi folks, my name's Debbie. I'm part of an amazing team supporting harm reduction at Main Street Project. Today we're going to chat about drug toxicity crisis and how we can all help keep the community safe by learning how to use life-saving medication, naloxone, also known as Narcan.
Everyone can be a part of supporting our community of folks who use drugs. You can help by learning how to use a naloxone kit. Naloxone, or Narcan, is used when someone is experiencing an opioid poisoning. Naloxone is a life-saving drug that can reverse opioid poisoning and has no known negative side effects, so everyone can feel safe using it. It can be administered nasally or by injection. This is a naloxone kit. It contains 4 vantage point syringes, 4 vials of naloxone, gloves, alcohol swabs, and a 1-way sheet for administering rescue breaths. Some signs of opioid poisoning include a person not responding, slow breathing or no breathing, tiny pupils, body bent at an awkward angle, bluish, grayish, or ashen skin, lips, or nails. Sounds that are similar to gurgling or choking.
If you suspect that someone is experiencing an opioid poisoning, before you touch the person, you need to ensure you are vocal about every step you are taking, just like this.
Hi, my name's Debbie. Are you okay? I'm going to shake your shoulder to see if you're all right.
Let them know that you're going to check for signs of breathing and a pulse. If the person is not responding or not breathing, call 911 immediately and let them know you have an unresponsive person and need an ambulance. While waiting for emergency services to arrive, administer naloxone, grab your naloxone kit, and put on the pair of gloves in the kit. You want to ensure that when you give someone a dose of naloxone, you'll be administering it in a large muscle area like the upper arm muscle, thigh muscle, or butt muscle. If you have access to their skin in those areas, you can use the alcohol swab to clean the area. But if not, the vantage point needles included in the kits are strong and go through clothing, including denim. Open one of the syringes. These can be a bit sticky, so pull on the syringe slightly and then push it back in. This will make it smoother when sucking up the naloxone into the needle. Then, remove one of the vials of naloxone. Ensure that all the naloxone is at the bottom of the vial. If it isn't, you can swirl the vial a couple of times and the medicine will collect at the bottom of the vial. Hold the vial in one hand and carefully break the top of the capsule off with your other hand, breaking the glass away from yourself for safety. Once the vial is open, blow the syringe with the medicine, then hold up the syringe and push out any air that may be inside. You can do this until a small droplet of naloxone can be seen coming out of the syringe. You are ready to administer naloxone. Ensure you communicate your actions at all times.
Frank, I'm going to give you some naloxone now.
Ensure that you administer naloxone at a 90-degree angle going straight into the muscle. Press on the syringe, pushing all the liquid in until you hear a click. Naloxone can take up to 2 minutes to work. If you do not see a change in 2 minutes, prepare another dose.
Naloxone can be administered every 2 minutes until paramedics arrive or the person begins to show signs of alertness. We are seeing that it is taking more naloxone than it used to, so be prepared to use all 4 vials and possibly more.
If someone is not breathing, you should administer rescue breaths.
Rescue breaths are a critical part of ensuring the safety of the person who is experiencing an opioid poisoning. The longer someone goes without oxygen to the brain, the higher chances are of someone experiencing potentially irreversible brain damage.
Here is how you do rescue breaths. Ensure the person's head is tilted back and check inside their mouth for any obstructions. Pull out the 1-way air sheet from the naloxone kit and begin performing rescue breaths. Ensure you are plugging the nose when giving breaths. If the person has a clear pulse, chest compressions are not necessary as their heart is beating. If they have a pulse, 1 regular breath every 5 seconds until paramedics arrive will be enough. If there is no pulse or you are unsure if one was detected, proceed with chest compressions and rescue breaths.
Continue with rescue breaths and naloxone every 2 minutes until paramedics arrive or there's a change in the person experiencing the opioid poisoning. Changes can be obvious or subtle, ranging from opening their eyes, making noise, moving parts of their body, or completely sitting up. It's important to know that when someone becomes conscious, they can have a range of reactions. They may be experiencing some withdrawal symptoms and pain, and it's important to give them some space and let them know that they have an opioid poisoning and that they are safe. Everyone has a choice to accept medical support from emergency services, but you're best to encourage it, as the effects of naloxone can be temporary. And depending on the amount of opioids in a person's body, they could potentially become unconscious again.